Okay, we're live.
Hi, welcome to Alvernia Live Chat, and we're now live across Instagram, Facebook, and TikTok. My name is Dr. Shanna Ng, and I'm a dermatologist with subspecialty interests in Paediatric Dermatology. So I'm really glad that you've taken time out during this lunchtime to have this conversation. We'll keep it sort of like more lightweight, so you can ask any questions, any burning questions that you want to ask. And I'll try to take this next half an hour to try and answer all your questions. So today, the main topic is common skin conditions in children, but any burning questions at all, please feel free to ask and I'll try my best to answer. So I'm actually a dermatologist by training, but my subspecialty interest is in children, and I see children all the way from newborn, so as early as like 0 days old, to up to about 18 years old. This covers a really wide range of conditions. Sometimes when parents ask me, it's like a common condition like eczema, is my child going to outgrow eczema? It's kind of like easier for me to put into perspective because I also see adults, so I actually see children all the way to adulthood, so I can roughly get an idea as to how to manage from as early as like infancy all the way to adulthood. So if you have any questions, do feel free to ask. Okay, I think we have our first question. Will my kids outgrow eczema? This is a really common question, especially during the current haze. Eczema flare-ups are coming up this last week or so. So eczema being one of the most common condition I see, 1 in 10 or 1 in 5 children might actually have eczema sometime in their childhood. So the reality is that if children have eczema during the first year of life, so during infancy, up to about 18 months old, actually don't fret, okay? Parents come in quite anxious because, like, especially on the face, eczema on the face, they're worried about like scarring, or like, for example, their eczema over like, especially weepy sort of like eczema that they look quite challenging to treat, especially on exposed areas like their limbs. They're always very worried, is it going to scar? Is my child going to outgrow it? Well, the truth is, if eczema first presents during the first year of life, up to about 18 months of age, the chances of outgrowing is very high. As high as 60 to 80% during the primary school going age. So yes, your child can actually outgrow eczema, especially if it starts really early. So in terms of managing eczema long term, the truth is nothing beats getting into a good skincare routine. So when they are like little babies, right, their body surface area is quite small. It's actually quite easy for you to sort of like choose a skincare. There's so many cleansers out in the market. Choosing one that is fragrance-free, paraben-free will go a long way. As your child gets to primary school going age, this is when they actually will voice out, I don't want to put the moisturizer, right? Too sticky, I don't want. And they're always and parents and kids are always in a hurry. They're always hurrying from one class to another class, going from one place to another place. And sometimes when they do sports or certain activities, right, they're very hurried, right? They will like, especially before swimming, like how to put moisturizer, how to put sunblock before and after the activity. So the truth is, just get them into like a habit that, okay, they have to, firstly, they must use cleanser or body wash. In the days gone by, we didn't have so many options. You talk to an old school skin specialist, the skin specialist will say, don't use any skin cleanser, just use water to shower. But now, we have so many choices. But really, to just get them into a good routine of like, okay, using a body wash, body cleanser, and after that, moisturize, especially after a shower. So this kind of skincare habits, we try to introduce from very early on, so that accompanies them all the way till their teenage years, where you have a different set of problems. At that time point, it might be difficult for you to apply anything on your child, but then if you already started that routine very early on in their in their primary school going years, or even before that, the kids are nowadays very intuitive. So you get them into that routine, and then later on they'll be able to hopefully adopt that habit on their own, to shower and just get the habit of putting on moisturizer on, because moisturizing will be the mainstay of treatment in trying to protect the skin's immune system. The skin is the largest immune organ, and your skin is the first defense against the outside world, right? So imagine your immune system as immune soldiers from the head to the toe. So moisturizing the skin, avoiding any cracks in the skin will prevent the immune system from being readily exposed to the outside world. So if it's protected from the outside world, then it wouldn't so easily, the eczema and the immune system will not so easily sort of like flare up. Yeah. So the next question that we have is, how often should a child with sensitive skin bathe? And what is the ideal water temperature? Generally once a day. If your child tends to sweat quite easily, then twice a day should suffice. The ideal sort of water temperature would be room temperature, really. So we always say lukewarm water. So if your child is showering and the mirrors start to steam up, right? Or even an adult starts to shower and the mirrors start to steam up, that means the temperature is actually too high. We try to limit bathing, right, or showering to less than 10 minutes. Sometimes we don't realize that, especially some teenagers, we don't realize that sometimes they're taking quite a bit of time in the shower. So until we ask them, and then we realize that, oh, actually they're taking, for example, half an hour. Half an hour is quite it's not unheard of as well. So we do want to try lukewarm water, usually about 32 to 35 degrees, and also to avoid prolonged showers, so less than 10 minutes should be okay. Yeah. So okay, now we have another question. Okay, this is from Facebook. Hi, Dr. Shanna. How can parents tell the difference between baby acne and other skin conditions like eczema or heat rash? Okay, so baby acne, as the name suggests, right, baby. So baby acne generally is during the first month. We call it neonatal acne. And then there is infantile acne, which occurs below the age of a year old. So the difference is that for acne, right, for baby acne rather, which occurs during the first month of life, generally there's not, you don't have the usual blackheads, whiteheads. They are all very singular. We call it discrete, individual little bumps. These bumps, unlike pubertal acne, so right, teenage acne, they generally do not leave any scarring. So that's the main concern that parents have. Coupled with sometimes, because baby acne is due to too much yeast on their all-bearing glands. So coupled with that, sometimes we also see some yellowish scaling on their scalp. Sometimes you might see some yellowish scaling on their ears. So this is a sign that this baby acne is being triggered by yeast. So not so much like teenage acne, right, which is due to like too much oil production and clogging of their glands. And then there's infantile acne, which occurs later on after the first year of life. We notice that, how come this acne is a bit stubborn, as opposed to baby acne, which actually will self-resolve. So we generally do not institute too much treatment during the first month. We allow it to self-resolve. Infantile acne, on the other hand, sometimes the lesions are a bit more stubborn. That's why it can persist to about a year of life. We usually see this due to hormonal changes. So usually it will be in boys, right? Boys, because of the skin getting used to the male hormone in the infants. Even so, we treat it very similar to teenage acne, but we generally don't use harsh sort of like prescription kind of creams. Just gentle cleansing, and also sometimes it can actually fluctuate. So if it's very hot, very sweaty, child's very sweaty, then sometimes you might see more reddish bumps coming out. But a lot of the times during the first year of life, any acne that comes up, we allow it to self-resolve. The age group that we're concerned about acne that we shouldn't be seeing is when they get acne between the age of 1 to 7 years old. So if your child you suspect has acne bumps, right? between the age of 1 to 7 years old, then do bring them to see your pediatrician or your pediatric dermatologist. Okay, so from Instagram, we have another question. Do kids outgrow eczema and hives? Usually around what age? Okay, so the first part of the question, do kids outgrow eczema and hives? So thank you for joining in. Earlier part, we were mentioning that eczema in infancy, during the first year of life to up to about 18 months old, we see eczema during this stage. The chances of outgrowing is actually very high, 60 to 80% during their primary school going years. If they have hives, okay, hives, right, is divided into short-term hives, so we call it acute hives, or chronic hives. Chronic hives is where the hives, right, if anyone doesn't know what's hives, they look like mosquito bites that keep coming and going, so this, if it's prolonged, like the hives keep coming on beyond 6 weeks, then we call it chronic hives. The difference between the two is that for acute hives, right, which is within a 6-week period and goes away spontaneously on its own, the triggers are different. So for acute hives, probably the most common trigger is recent, like cough, cold, runny nose, the common cold is the most common trigger for acute hives. Sometimes diarrhea, so any forms of viral infection is one of the most common triggers for acute hives. Certain medications, sometimes fever medicines may trigger hives as well, so drug allergy can trigger acute hives. Whereas chronic hives, they persist longer, so we call it due to physical elements, we call it physical hives, or sometimes there's no trigger. The hives may just be very random and occur very randomly without any physical trigger. Physical triggers will be things like changes in the environment, so like heat, sweat can sometimes also trigger hives, so this can be more prolonged. There's also spontaneous hives where there's no reason, no rhyme or reason, the hives just keep coming up, and this can occur even daily. So this sort of chronic hives, the chances of the child outgrowing is usually there, but it may even persist to go up to about like 1 to 2 years, so have seen that happening. And the remedy for that would be sometimes patients come in and we might start off by doing blood tests first to make sure that internally nothing is triggering the hives. So like we might do a blood count, might do their inflammation marker or their thyroid blood test. If this is all okay, sometimes we do offer an allergy test as well, which that comes in the form of a skin prick or blood test. Often than not, we may not find anything in the skin prick test, but it might be an option to do so that can reassure parents that, oh, okay, there's actually nothing that's really triggering it, and it's quite spontaneous. So spontaneous hives, I mentioned, we don't really know what the trigger is, it just happens on its own. And the remedy for that would normally be some form of regular antihistamines. And bearing in mind that these antihistamines, we do try to encourage parents, because parents, I understand, not very keen on like, oh, I don't want to feed too many medications to my child, worried about the side effects of medications such as antihistamines. But generally, these antihistamines that we give for more chronic hives, right, which go beyond 6 weeks and sometimes can last 1 to 2 years, these antihistamines we actually encourage to give on a regular basis. And this is on a regular daily basis, sometimes for a few months. Yeah. So after they outgrow, will it come back again? So this is a really good question. So if your child outgrows eczema, let's say they had it during the first 1 to 2 years of life, and then in primary school, at primary school they outgrow their eczema, because I do see adults as well, right? Because I see, because my patients span the age from 0 to all the way to like 100 years old. So yes, more often than not, there is still a chance that in adulthood it might come back again. So what are the chances of it when it comes back? Is it going to be quite severe? This is very, very difficult to say. But by looking at the patient's profile that I see, a lot of patients who've actually had no childhood history seem to later on get quite moderate to severe eczema. So a lot of them, actually I find that adult onset severe eczema tends to not have too much of like severe eczema during childhood. So I think the chances of outgrowing when you have it as a child is really quite high. So take for example, I might see a 30-something-year-old patient with eczema who frequently tells me that, oh doc, I've never had eczema before. You know, they always say, oh doctor, I've never had eczema before. My mother also told me I never had eczema. How come I have eczema now? So I think the chance of outgrowing eczema is really, really quite high. So the data that we have is 60 to 80% chance of outgrowing if they have childhood eczema. And the truth is, I think the reason why patients tend to outgrow their eczema is that there's an entity known as the atopic march. So what's the atopic march, right? So this is when the eczema, which is due to a very sensitive immune system, so we call it atopic eczema, otherwise known as atopic dermatitis. The immune system from the skin then moves on to another organ. So they outgrow their skin, but sometimes what happens is that the immune system marches on to, let's say, the nose to cause allergic rhinitis, or let's say the lungs to cause asthma. So really, we don't see severe eczema patients having, let's say, severe asthma. So this is not common. So we suspect that the immune system moves from another organ, so such as the skin, to affect the lungs or the nose. Okay. Okay. So for those who have just joined us, welcome to Alvernia Live Chat. My name is Dr. Shanna Ng, and I'm really glad that you have taken time out during this lunchtime to join us in this light-hearted conversation to answer your questions about your child's skin condition and how to manage them. So we have another question from Facebook. Okay, hello Dr. Shanna. My son has a small mosquito bite-like red spot on his face for the past few months. It is not painful or itchy and has not been spreading. Would this be a cause for concern? Okay, so, and the second part of the question is, could it possibly be a cyst or a clot pore? Yeah, very valid questions. So if the same mosquito bite has been there for the past few months, it is, and it's not painful or itchy, the likelihood of it being a wheal, so like a hive from the insect bite, is quite low. You might want to see someone for this, because most of the time mosquito bite reactions, or even a very exaggerated mosquito bite reaction, right, should go away within 4 to 6 weeks. Even though it's so, when you get a mosquito bite, the immune system is quite sensitive in some patients, so it might trigger like a secondary eczema or a hive. That immune system normally 4 to 6 weeks later should calm down. So if it's still persistent beyond that, then yes, it could be one or many other things. Whether it's a cyst or clot pore might be hard to say. Like I said, if a child between the age of 1 to 7 years old has like a blocked pore, do seek treatment, because this is also not the age group for getting like acne or like, so we do want to suggest, so I do suggest probably seeking a professional opinion on this. Okay, another question from Instagram. Okay, my 8-year-old niece has small raised white or yellowish bumps on her face. Yeah, okay, so this is, thanks for joining in. So just now we had this conversation about if your child is 1 to 7 years old, it's actually okay to have like, so it's actually not okay to have like blackheads or whiteheads, but 8 years old, sometimes we do see them getting into puberty, right? So yeah, sometimes we do see some whiteheads or blackheads. If there are quite a number, then we do, and you're concerned, I always say do seek professional advice. So that's my suggestion for you. Okay, now we have, so TikTok starting to have some questions now. Okay, at what age can babies start using sunscreen? Very good question. And what should we look out for when choosing one? So always look at the advisory on the sunblock that you are purchasing. In general, it's 6 months and above. Some sunblocks might indicate 1 year and above. What to look out for when choosing one? So look out for, generally try to, because nowadays there's really a lot of options to choose from. So if you can really go fragrance-free, paraben-free, that would be very helpful. That can go a long way to minimize the exposure of your child to common contact allergens such as fragrance and parabens. Okay, now from Facebook. Hello, Dr. Shanna. Is it safe for children to use UV? Oh, okay. So UV protection cream would be sunblock. Yep. So that's actually okay if you look at the advisory and it says okay 6 months and above or 12 months and above, and if your child is above the age, then yes, you can definitely put some protection. Okay, hi doctor, my child started with some bumps on his forehead, so this is a boy with forehead bumps and slowly spread to the rest of his face. Okay, this could be one of many things. Sorry, but let me think. Okay, slowly spread to the rest of his face. It is small and skin colored. Okay. So the time frame will be quite important. So like, was it within a day, within a few days? If it's quite quick, right? It was within a few days. Then sometimes it can be little bumps, can be one or so many things. Molluscum is quite common. It's a viral infection, one of the most common viral infections. Molluscum can look very much like a whitehead. The thing about molluscum is that it's contagious. So sometimes the kids, they like to scratch here, scratch there, then sometimes it transfers. Like I said, if your child is 1 to 7 years old and has like pimply looking bumps or like whiteheads, blackheads, then do seek treatment, okay? Because this is not the age group for getting acne. What could it be? Any non-steroid cream? Yeah, we have many non-steroid options ranging from antibiotic creams to like anti-inflammation medications that are non-steroidal. Yeah, but anything that's prescription, obviously, you probably want to seek professional advice for that. Okay, now, Instagram has a question, how do we remove the sunblock? This is a very, very common question I get in the clinic as well, because we are taught that, we're taught that like, okay, sunblocks are very creamy, very thick, right, quite occlusive. So, like women are told that okay, we got to use like special facial wipes, makeup remover, right? So the thing is actually for kids you don't have to. Like I said, kids, they don't really clog so much, so you don't really have to. Actually, I don't advise using too much facial wipes that generally have like a longer ingredients list, so higher risk of contact allergy as well. Definitely no need for any makeup remover, just a gentle cleanser. Like I said again, fragrance-free, paraben-free. When they are bathing, then you just wash off the sunblock. So that's my advice. Okay. So hi doctor, at what age should the kids start using facial skincare? Very good question. So the age of 8 and above, you can consider using. Like I said, get them. Thanks for joining in if you missed the first part, but getting them just into a routine, right, of taking care of their skin. So using a gentle cleanser and then moisturizing after will really, really go a long way. So at about 8, I find nowadays kids are quite precocious. Sometimes because of social media, they might actually learn way before they come to the clinic to see me. So by about 8 to 9 years old, that's also when they might potentially start to get acne. Singapore is very hot. If they enjoy a lot of sports, then sometimes you can get them started earlier, right? So they nowadays, I notice a lot of kids, if they do sports, they do like 5-6 times a week. Somebody doing 8 times a week. I'm like, how you do 8 times a week? One day was like, one day twice. Okay, so so even if you're very sort of like sporty, outdoorsy child, you have a very outdoorsy child, sweats very easily, then just get them started really at a young age. 4-5 years old nowadays, they're pretty smart and intuitive nowadays when they're like 4-5 years old, I find. So yeah, I can start at that age as well. Okay. So next question is, if my child has eczema all over and was prescribed steroid cream, what is the duration that she can be on it? Yes, good question. So, very, very good question. So, normally when I do a prescription steroid, because they are non-prescription, okay, the mildest topical steroid is a strength 7 steroid that you can get from Guardian Watson, don't have to see me. There are 7 strengths, 1 being the strongest, 7 being the mildest. So if I'm prescribing one that's a strength 6 and above, right, 7 being the mildest, then normally I'll put the instruction in twice a day, not longer than 2 weeks. Once better within a 2-week time frame. We reduce it to once a day for 1 to 2 weeks. So we try not to keep that topical steroid on for longer than 4 weeks. Yeah. Okay. Moving on to the next question. My 2-year-old son's eczema is just restricted to the folds of his knees. Yes. It comes under control when applying creams by the peds, but not going off and would come back. Okay, so it doesn't go off completely. Okay, so this is an area where the eczema in a 2-year-old, it's an area where the skin is generally quite thin, right? So the back of the knees. So normally we'll try to introduce a non-steroid at about the 3rd or 4th week, so that we can actually have something that can be used over a longer period of time to just bring down the inflammation over a longer period of time. So if you remember me saying earlier on, or if you're just logged in, basically when eczema, right, is triggered, it really takes about 4 to 6 weeks or sometimes even longer, to calm down. But we don't really want to use our steroids for too long. So once there's improvement, but maybe not completely gone, that's when we add our non-steroid anti-inflammation. Usually I'll add it at night. And this goes on for like 4 to 6 weeks just to calm down the inflammation over a longer period of time so that you don't have to keep going back to your rescue steroid. And then definitely not forgetting moisturizing consistently as well, especially after a shower. Okay, so somebody's asking about can 17 months baby apply sunblock? So thanks for joining us. So earlier on we mentioned, I don't know whether you caught me mentioning that just follow the labeling, the advisory on the sunblock. A lot of sunblocks nowadays would say 6 months or even 12 months and above. So your 17-month-old can definitely apply sunblock. But nothing beats staying away from the sun. But parents are generally concerned, like, okay, if I stay away from the sun, is my child going to have low vitamin D? The truth is, the studies show all you need is 10 minutes of noontime sun to get your vitamin D. Truth be told, a lot of us here, even though we're such a tropical country, a lot of us have low vitamin D. So you can also consider replacement vitamin D. But actually, if you avoid the sun, that's my best advice. Because sunblock, when you have kids that are running around, right, you have to actually reapply the sunblock. For a 17-month-old, thankfully, they'll listen to you. When you have a teenager, they might not listen to you. So putting on the sunblock every 2 hours, like I said, follow the labeling. It will tell you, okay, apply 20 or 30 minutes before going outdoors, and then reapply every 2 hours. But I mean, if you have a child who enjoys playing tennis or like rugby, right, soccer, and they're out in the sun 2-3 hours, then to reapply the sunblock again might be quite challenging. So if you can choose the timing of their activities under the sun, so that can go a long way. So try to avoid the sun if possible between 10 to 4 to 5 o'clock. So that can also go a long way in sort of reducing the UV exposure on the skin. Okay, so next question from Instagram. Does breast milk help with molluscum on the face? Okay, this is a really interesting question. Well, yes and no. The reason why is because molluscum is a self-resolving condition. So if your child is 5 months old, thankfully at the age of 5 months, the immune system it's actually more responds quite readily to helping your child fight the molluscum infection. So a lot of the times, given a few more months down the road, the immune system can actually help to get rid of the molluscum for your 5-month-old, especially since started 2 weeks ago. So give the immune system some time. But the evidence, I would say, for good scientific, strong evidence whether breast milk is advocated for molluscum, I don't think I can comment on that. But molluscum on its own can actually self-resolve. So, okay, so we have just 5 minutes left. Do feel free to ask a few more questions. We'll be happy to take them. maybe just finishing off from the molluscum question. So you know, if you were in Europe, right, and sometimes seeing a specialist can be quite difficult. You know, in Singapore, access to healthcare, seeing a dermatologist is quite easy. I mean, so in some countries, right, the dermatologist might even tell you if you have a molluscum, come back like 3 months later or 6 months later, let the immune system help to fight the molluscum. But here in my clinic, I have multiple options for treatment. It ranges from topical creams, and these are also prescription creams. Some parents may not want to put medication, especially if it's on the face. We have beetle juice. It's called cantharidin. So beetle juice where we apply, there's always a risk of blistering for that, which can be unpredictable. And there's cryotherapy as well, which is cold nitrogen spray. So all these are the treatments available. But like I said, especially on the face, and those treatments can sometimes cause blistering or scarring. Just let nature take its course. When to come in would be if the bumps start to spread, you know, your child's getting quite itchy from it, then do come in and seek professional advice. Yeah, okay. Would you recommend using ointment as a moisturizer for non-flare-up period at bedtime? Yes, especially because now it's very hot. We're probably going to have our air conditioning on. So ointments generally sit longer on the skin and help to moisturize the skin for a longer period of time, especially overnight, as opposed to creams or lotion. So yes, do highly recommend a more oily towel moisturizer for overnight use, especially if the air conditioning is on and you're worried that the skin might dry out too easily. Okay. Alright, so thanks for being so forthcoming with your questions and joining us today. I had lots of fun answering everybody's questions. In case you miss out on any of the segment, do feel free to join us and follow us on our social media page, Mount Alvernia. Thank you.